Hello and welcome to another episode of Transforming WHO, a series of videos where I interview colleagues inside WHO and outside about the work we do and how we try to transform. And today we are actually taping this in a temporary studio that we have set up in the corridors of the World Health Assembly, currently taking place here in Geneva. And I'm joined here in the temporary studio by Maureen Birmingham, who's head of the country office for WHO and PAHO in Peru. And thank you very much for joining me here in the studio, Maureen.
Thanks for inviting me, Soren.
And first, a little bit about yourself. I mean, you have an impressive 4-decade-long career in global health. I believe you started in veterinary medicine and epidemiology, and then 40 years ago, you started working for the Organization of American States in Haiti, working in disease control, epidemiology, and for a number of years with the CDC, the Centers of Disease Control. You're an American by background, I should say. And then sometime in that journey, you joined WHO, I believe, a couple of decades ago in Bangkok, I believe. You were head of our country office in Bangkok for a number of years, and then moving back to the Americas. And then you've taken up the position of being head of country office, or as we say, WHO PAHO Representative, PWR, in a number of American countries. Mexico, you were in Argentina during COVID-19, I believe, back in Haiti, where you started early in your career.
Right.
And then currently taking up your current position in Peru. That's an impressive career. Anything I missed, Maureen?
Well, I spent a little bit of time in WHO headquarters as well.
Yeah.
But you're right, Soren. I feel very I feel very fortunate to have all these experiences that I've had. And I started, as you said, as a veterinarian, first practicing in the U.S., but then did go to Haiti and worked in veterinary public health, as animal health is an important source of people's livelihood. But increasingly confronted a lot of issues of public health, zoonotic diseases, food safety issues. In Haiti, we were often dealing with anthrax, with cysticercosis, with rabies, things like that. And so veterinarians from the U.S. are trained in public health, but I became increasingly interested in that area, moved on to Bolivia, where we're also training veterinary technicians in the same type of model. But again, and confronting a lot of these public health issues, and found, although I was trained in this area, it was hard to cross that line and talk with the public health side. Those mechanisms, what we call now One Health, weren't really well established back then.
Now there's a huge focus on, as you say, One Health and about zoonotic diseases and how to tackle that. But I guess at least in the last 2 decades, I mean, you've been broadly focused on public health. You have the vet side, the One Health side, the zoonotic diseases in your background, but it's much more broadly focused, right?
So with this somewhat of a frustration, I went back and got a master's in public health, so I could cross that side and have my foot on that side with the credibility, with a master's in public health. And from there, I was in Boston doing my master's, went on to CDC, where they have this great program on training field epidemiologists, all the fun work, basically. And so did that training program, and never intended to leave completely veterinary medicine, but loved this area, loved epidemiology. And at CDC, I also joined the preventive medicine residency program, which is how I ended up at WHO and headquarters. Because the second year of that program, there was an opportunity for a resident to be in WHO. So that's how I landed in WHO and in the polio program, or the immunization program.
4 decades in public health and global health. That's an impressive career. What are you most proud of? Biggest achievements in the 4 decades, Maureen?
Yeah, hard to say, and it's not just my achievements. Everywhere I've been, it's been a team, working as a team, of course. When I arrived, if I can say in sort of chronological order, places I've been and things I've remembered, in WHO headquarters, I arrived just in the early stages of polio eradication. So at that time, we were setting up the very basic pillars of what to do. The routine immunization, of course, was ongoing, but strengthening that, the campaigns, but then surveillance to really guide the strategy. So I was on the surveillance side and setting up with the team, and setting up the sort of standards and the tools to go do that, and then and then rolling that out with the regions. We had some great regional advisors, and so the team in headquarters and the regional advisors, we were rolling out polio surveillance. And within a few years, we had weekly case-based reporting coming from most countries in the world in a standardized
You could
way.
easily see the successes in an area like polio eradication.
Yeah, so that was a big collective, I'd say,
Back in the days when you were in the polio program, would you have expected that by now we had eradicated polio globally?
I would have hoped so. I remember the World...
That was being said back then. I remember some dates being announced that we had passed. But,
exactly, like the year 2000 was the first goal.
Exactly.
So I remember the World Health Day was polio eradication by the year 2000. So yes, still striving to get there.
And in your career, any regrets? Anything you regret not doing, or anything you still want to do in your career? Any big achievements you are looking for?
I really enjoy working at the country level. I enjoy the variety of different country offices and what they present to you. I wouldn't say they're regrets. It's just that I experienced working at headquarters level, then in the regional level, working on pandemic preparedness in the Southeast Asia region, which I really enjoyed. And I somewhat accidentally fell into the country representative position, first in Thailand.
But let's turn to the country work that you've been doing. I mean, your last three postings and your current, is Haiti, Mexico, Argentina, and then now currently Peru.
Right.
4 very different countries, I'm guessing.
Right.
Haiti, certainly very, very challenged, vulnerable, crisis, war, humanitarian catastrophes. A different situation in Peru, I would expect. What are the key challenges in Peru?
Well, in Peru, it's a middle-income country. It's, as in many countries in Latin America, very fragmented, the health system. So working on sort of unifying that system more, defragmenting, but it's also decentralized. And so if we just work at the central level, which we do, on norms and standards and establishing those, we know we need to get out into that we call the territory, get out into the...
So Peru has some rural districts, indigenous populations that are hard to reach,
Yes, we've got like the Amazon area, and yes, more than 50 different languages, really interesting, very rich in culture. We've also got the highlands, in the Andes Mountains, populations there, very high rates of anemia. We've got also the coastal areas, very prone to disasters. So priorities there, we work on some of our big priorities in the region is getting maternal mortality down. We call it zero maternal mortality, or at least the preventable maternal mortality. That's a big priority in Peru, especially in the Amazon area, in indigenous groups, and that's where we have to work in a very intercultural way, understanding how their cosmovision, as we call it, and how we can work with them to find the solutions on preventing this preventable mortality.
And what's the role of WHO, like a country office? You lead a country office in Peru. How big is your staff? What's the role of that country office?
We've got about 45, 50 people. It varies, but depending on what we're working on. We do work on migrant health as well. It's a very vulnerable population, 1.6 million migrants coming into Peru, a country of about 34 million. We work on health systems, as mentioned, on some of the financing, working on what are they spending on primary health care, how do we make primary health care really work within an integrated service delivery
And you work
network.
very closely with the government, especially the Ministry of Health, supporting them and so on.
So based on their priorities, so we work on some of those health system issues, also on getting access to medicines, the PAHO Strategic Fund to help gain access through pooled purchasing mechanisms, where you get the lowest price of assured quality medicines and technology, moving into telemedicine. So that's a very potent way of reaching underserved populations in Peru.
So that's basically coming with the norms and standards, the technical guidance from WHO and from PAHO, and then providing that, supporting that for the government of Peru in their priorities.
That's right. It's very much of a dialogue of what we can offer. Sometimes it's just convening. Sometimes with the fragments, we can convene people that don't normally maybe work together and just convene them. We just did this for the yellow fever. There's a yellow fever upsurge in several countries. Often it's capacity building and bringing the standards and the best practices. It's sharing experiences, sometimes getting countries together to share experiences. One country has more capacity. Right now we're collaborating with Chile on stem cell transfers for child leukemia, collaborating with Argentina on organ transplant, collaborating on childhood cancer. So we often also there's a lot of human capacity, human
Yeah.
resource
And
capacity.
coordination. WHO and PAHO in the Americas also plays a special role in sort of the ecosystem of various stakeholders and agencies and initiatives.
Absolutely.
If you can speak a little bit to that, you say we convene or you convene. I mean, what's that role?
Right. Well, as mentioned, sometimes the solutions are there. There's an issue, the solutions are there, but it's sometimes getting people in the room. We don't necessarily come with the solutions, the packaged solutions, but we get people in the room to really take a deep dive into what the issue is, and then what's the pathway forward.
And that might
So,
be other multilateral agencies who also are active
absolutely.
in Peru. It might be NGOs, it might be foundations, philanthropies, etc., that are all active in supporting public health in the
Right,
country.
right.
Yeah.
So we do have that. We have, the UN system's there. So very much working on some of these common areas. For example, the anemia problem in Peru is very high. So the different agencies can bring their strengths to the table, and WHO also. So we do have areas like that where we work with the whole UN
And
system.
there's a framework for the UN
Yes.
sustainable the framework and a resident coordinator. I believe you actually, a couple of times in your career, you also served as a UN resident coordinator or acted as such. And
Yes, we are asked to do that. I did serve for quite a long time in Thailand. I think about 9 months. So that was a very interesting experience during also a major flooding, a major disaster. So that was also leveraging the humanitarian system to respond to that massive flooding that lasted for a long time in Thailand. And then periodically in other countries, one is asked to serve as the resident coordinator and sometimes humanitarian coordinator. So yes, this was in Haiti. This happened also occasionally
must have
in
been very
Mexico. Yeah.
difficult in Haiti with the humanitarian challenges. And
Right, so that's a very different, compared to the other countries I worked in, which were more middle-income countries that have their issues in terms of inequalities, inequities, some high human capacity, but also a lot of these issues. In Haiti, it was really challenging in terms of more of a humanitarian setting. We had really difficult security issues.
Yeah, I could imagine.
Declining security, and then just a lot of incredible human suffering there. As gangs increasingly have taken over the capital city, people are really quite terrorized, by the situation and the violence. But also we working, of course, in the whole UN system, across the UN system and the humanitarian system, but finding creative ways forward.
Yeah.
In that kind of situation. How do we make sure we have life-saving care available? How do we get access to some of these populations that are often closed off from the gangs there, that we can't even access some of these communities? So how do we keep immunization coverage? We really had a strong team trying to keep, some of those basic services. A woman with an obstetric emergency, how does she access care? So,
and even just having the challenge of not having, like security issues, like you said, not having a stable government that you can interact with as
right.
a
Yeah,
WHO
I was there when
PAHO.
the president was tragically assassinated,
Yeah.
and following that was an earthquake, and so we had deteriorating security while we were trying to
But it's
respond
a
to this.
different context in your current position in Peru. I mean, you took up that position 2 years ago, I believe, in 2023.
October 23.
Yeah.
Yeah.
And then last year, you actually, you and your team, and with the government, I believe, developed a country cooperation strategy.
That's right.
Which is basically an instrument of describing what WHO and PAHO from the country office will support the government with. Can you speak a little bit to how did you develop the country cooperation strategy and what are the key focus areas of that?
Right. So we went through one of the key things about a country cooperation strategy is not just the product itself, it's the process of getting there. It's the excuse to have that dialogue with the government. And we have a structured approach within this region of prioritizing. What are the key in all of the PAHO and WHO strategic plans, all the areas. what are the key things for Peru? And so we were able to establish that dialogue. So that's with the government. So we have sessions with the government. We also went off and talked to people individually, former ministers, vice ministers, and said, what do you want to see more from PAHO and WHO?
And what did they tell you? What became the key priorities, and how did that emerge? And what are the key priorities?
I think, just to answer your first question, I think they wanted to see more multi-sectoral collaboration.
Yeah.
That they saw sort of the health sector, not WHO PAHO per se, but just the health sector was a little closed, and we needed to open up and collaborate more with some of the other sectors. So that
All
was
of government approach, health and all
exactly,
policies.
which we couldn't agree more with. So
Yeah.
that was useful. The priorities, though, were somewhat the classic priorities. A lot of the health system work, really making it reality, primary health care, working with an integrated service delivery network, making that work, the financing that goes with it, the human resource, so some of those systems, those building block system issues are quite classic that we work in. Getting access to technology and medicines, that was one big area. So the second area is the disease control. On the communicable disease side, we're still dealing with tropical, neglected tropical infections and diseases. We're dealing with the big three of malaria, TB, and HIV. Peru's a high burden country for tuberculosis, so that's very much on the front burner. Also on, of course, the health promotion side and working in these areas that require multi-sectoral collaboration, whether it's road safety or whether it's working on other social determinants and environmental determinants, climate change, et cetera, et cetera. And then, of course, the emergency area.
Yeah.
Peru is a place we have, earthquakes, we have shakes every day. And then, of course, there's occasional massive ones. So really having disaster preparedness, not only for earthquakes, but also for floods, landslides, so severe weather events, as well as there's a lot of tropical diseases. Like, for
And then
example,
once you have the country cooperation strategy in place, then it's signed by the regional director, Dr. Jarbas, on behalf of WHO PAHO, and then
Right.
the government,
Minister.
the Ministry of Health, typically.
Right.
And that's for a 5-6 year period, I believe, the country cooperation strategy in
Yeah, we made it-
2030, or...
Well, it's really up to us with the
Yeah.
government to decide.
But what
And-
happens next is basically my question. So now you have the country cooperation strategy. How does that then commit you and the government to
Right.
deliver?
It's more of a framework. It's a framework that we can constantly go back to and make sure we don't stray too far from, keep ourselves focused on what we agreed were the priorities. And of course, then through our biennial planning of program budget and our work plan, we try to stay within that framework, unless things change in the country. We're not.
So that's basically steering and deciding how you prioritize the resources, or how WHO and PAHO prioritizes the resources towards supporting the government.
Exactly.
Yeah.
And as governments change, which they do in Peru, we can go back to that as sort of, well, this is what was agreed. But there's always the opportunity to update it or modify it, based on if there's a change in the government. So it does provide a framework.
In the last recent years, there have been a lot of focus in WHO and PAHO on strengthening our country offices. That's been discussed for as long as I can remember inside this organization, but it seems like we took the next step when we established the so-called Action for Results Group, the ARG, that was established in 2022.
Right.
And that had a focus on basically strengthening our country offices, capacitating them, empowering them,
Right.
including the country office heads like yourself, in making more decisions, and also allocating funds to ramp up and secure the capacity, the staffing also of the country offices. Though that's now in its third year.
Right.
You've just taken over as co-chair of the ARG. So currently we're in a crisis of losing funding, and we had just in this Health Assembly a difficult process with our member states of balancing our budget for the next 2 years.
Yeah.
And balancing it between aspirations, what do we want, and then realism, how much
Right.
money or how little money do we have.
Right.
So in that context, how do you see that country strengthening work in the next couple of years?
I think it's more important than ever
Yeah.
to maintain this vision, and the DG has also reiterated that over and over during this week, even of the World Health Assembly, that his commitment to maintaining or strengthening the work at country level. And again, this is all about translating the normative work of WHO into results at the country level. So very much
But
within
we're
that
also
framework.
faced with a funding crisis. I mean,
Right.
this program budget that was just adopted by the Health Assembly is more than 20% less than
Right.
previous bienniums. So, I mean,
we have to face reality.
Yeah.
And we have to adapt to that new reality. And so as the ARG, we are working on that. For example, the ARG in the past established what was called Core Predictable Country Presence, CPCP. It's a concept as well as a model of looking at different types of country offices, from the very maybe upstream advanced countries to the countries that are fragile and in conflict, and what
kind of
differentiated
positions would need to be there,
differentiated
etc.
approach based on these what's called typologies. So there was a model established, and then what kind of staffing? What does that look like in each of those country typologies? We have to look at that again in light of this new reality and see what's a more maybe slenderized version. What can we do to adapt to this maybe
And
more
looking
constrained
at our
environment?
priorities is also certainly what is emerging very much from the discussions and decision here at the Health Assembly. I mean, we need to prioritize looking at our core mandate, our core functions,
Absolutely.
leading and convening our norms and standards, etc. So
Right.
I guess that goes for all levels of the organization. Country offices, regional offices, and headquarters.
That's right. We have to face reality. We have to be creative. We have to be innovative. We have to look where we do have more opportunity or more opportunity for more efficiency. We have to decide what perhaps we're not going to do anymore. We have to face it, and prioritize and be strategic. So I think the ARG is very much facing that also. So looking at ways we can slenderize that CPCP model, but still maintain the concept that there should be, when you go to a country office, a core, predictable country presence that should be also have predictable financing. So that whole concept, I think we will very much continue to promote, and we think it's still realistic to promote that, but perhaps relook at the model in a more slenderized way. The delegation of authority to WR so they can really move and be agile and deliver results
so there's
with their
also
team.
an opportunity in this crisis. I mean, there's an opportunity to change our ways of working and become more efficient and more focused.
I think so, yes. I think that these kind of crises there's always opportunities, right? They always say don't miss a good crisis, right?
Exactly.
So I think we're embracing that.
By the end of the day, it is a major crisis, fair
Yeah.
to say, of losing funding, not only for WHO, but from many other multilateral agencies, also outside of the health space. Many of our sister agencies are also getting defunded. But even more so also for global health programs in countries that are losing funding. So it's a huge crisis. But many are also saying that it's a crisis of multilateralism maybe being challenged, of our core principles and values. Do you agree with that assessment of the crisis?
I think we're in crisis. Yes, we know we're in crisis. There's a lot of questioning of the multilateral system. There's a lot of questioning going on, but I think we can turn that into an opportunity as well. I feel even from this week at the World Health Assembly and what we hear from the member states, I feel more encouraged that member states are saying we still need WHO and we need the UN system. Yes, we need to look at efficiencies. We need to look at where there's mission creep or where we're overlapping or what we can let go of or sunset.
So there's still a future for multilateralism.
I still very much believe that. Yes, I'm still maintaining some optimism.
And we did see that commitment here in the Health Assembly. I mean,
We heard it.
the pandemic agreement, the program budget, etc.
Yeah.
So.
And the important thing is that we keep delivering.
Yeah.
We keep delivering results. And I think that's part of the ARG. This upcoming work is we need to really focus on accountability, delivering results, showing results as part of the work of this, of establishing core predictable country presence, the financing, that we deliver results. So with the country. But
So you seem like an optimist, Maureen.
well, I don't stop trying. I guess I'm resilient from from the past because this is not the first time the organization has gone through crises. So I think we can weather it.
Good. Thank you very much for joining me here in the studio. Thank you very much for your optimism
pleasure.
and for sharing your experiences.
Very much a pleasure. Thank you.
Thank you, and
Søren.
thank you very much for watching another episode of Transforming WHO. And do stay tuned on this channel for upcoming episodes.